Everyone, and welcome. Welcome to, well, where I am is a rainy Friday. So I hope where you are is more sunshine. I'm Reena Sangar. I'm the head of digital and connected health at Ipsos. Ipsos is a global market research and insight agency. And we do research. So of all things and queries that we have, we often find ways to communicate and look to answer questions that are happening in healthcare. And one of the greatest pleasures of my work and my job is the ability to connect with individuals who I consider to be trailblazers, individuals who are pushing the field, thinking ways to make change. And one of the most significant changes that many people are focused on is the future of health, how we use technology, how we use digital appropriately to make real changes and shifts and support individuals to take better care of their health. And with that, I'm delighted to introduce our Reach Live guest for today, Dr. Hemalee Patel. Hemalee, please introduce yourself.
Thank you, Reena, and thanks for having me. I'm super excited to be here. It's always fun to have a conversation with you. I am a physician, and hello, everybody. Thanks for joining this morning. I'm a physician in internal medicine. I practice in San Francisco at One Medical. I am also our clinical design lead for chronic care management and remote patient monitoring at the company. And so looking at how technology coupled with primary care is changing and helping augment patients' lives.
Well, it's a fascinating role. I'm sure many would agree, and few and far between from my own personal knowledge of the work that I conduct. So let's talk about that. Let's talk about what does a role like that look like? What does your day-to-day look like? Give us a sense of some of that.
Yeah, definitely patient care. I think I learned so much from my patients just in seeing, and diabetes at the forefront of primary care. And prior to me coming on to One Medical, I was a hospitalist and still practice occasionally in the hospital. And so learned a lot in terms of patient motivation and habits. I am very interested in design-centered thinking in healthcare. And as part of the quality effectiveness, clinical effectiveness committee, also spending time in meetings discussing, are we actually helping? Are we actually improving our patients' outcomes and improving metrics that we're concerned about? So yeah, day to day, it's practicing, it's meeting with product. The company is a full technology stack company platform, and so it's fun because you're able to do a lot in terms of your ideas with the folks at the company, and so just ideating and then actually pushing it out in terms of pilots in different markets, different districts, and testing it out using data science to see measures of success is a really fun part of the day.
Yeah, I can imagine. In terms of the patient types, I mean, you've talked a little bit about, the different types of patients you see. Give us a sense of the different complexities and groups of individuals.
Yeah, it's a lot of, actually, it can vary. We see a lot of younger patients, obviously, in the Bay Area, but still chronic disease is coming up over and over again in a younger patient population. And so what was once thought of to be an older person's disease is no longer the case, and they're just presenting in different ways. So patients may come in with anxiety or fatigue or, acid reflux. And if you look a little bit closer into their risk factors and take a physical, you start to understand that maybe they might be pre-diabetic, or they might have hypertension, or they might be on medications that they weren't aware of that are leading to this. And so it's a mixed bag of patients, but we tend to see similar disease states coming up in the different populations.
And how open do you think from your experience, how open do you think patients have been to thinking about the role of technology in helping them?
I think my younger patients are definitely more, they're coming in with their iWatch and iWatch equivalents. And so they want it, and they would love for, a provider to be engaged from a technology standpoint, like look at my steps, or this is what my sleep is doing. My older patients are interested. It's more the tech education aspect of it, but they're actually become quite savvy. And I don't know if the pandemic has actually pushed more people into just kind of using wearables and using technology as an adjunct to their provider. But it's definitely something that people are interested in. It's just making sure that you're not overwhelming them with all the different options that they can have.
Yeah, I completely understand that. I mean, when we think about, you talk about programs and interventions, ultimately changing behavior is hard.
Yep.
It's one of advice is not enough. We've seen that time and time again. So let's talk a little bit to the complexity of changing behavior. What are some of the things that you're seeing?
I mean, it is hard. And when you are thinking about changing one's behavior in relation to chronic disease, it becomes a bit tougher because it's chronic for a reason. These are learned habits that are not going to go away easily. And then there's a big component of mental health that goes on with these chronic diseases as well. And so it requires a multidisciplinary approach to a multidisciplinary situation or a multi-complex situation. And so really, I think part of it is meeting the patient where they're at. Not every patient is going to be in this activated state of wanting to get help. And so it's really understanding what are their motivators, and understanding that their motivators might be very different from you as a healthcare provider's motivator. And then gently keeping them within the realm of your priority list, I guess, for patients, in the sense that at some point they will be activated, and you want to make sure that you're still in touch with them at that moment. And I think that that's where technology can really help in terms of closing that gap, because if you tell someone who is, 35, that they have diabetes type 2, and that in 15 years or 20 years, that's going to affect their eyes and their, kidneys, and it's too far down for them to understand. Right now, they're just coming in, maybe feeling a little bit fatigued, maybe a little bit thirsty, but they don't really know what those long-term implications are. And so you want to make sure that you're still engaging with that patient for the long haul in ways that make them not feel badgered, but still held.
Yeah, it's such a balancing act, from a clinician perspective. Even understanding like the segment or the persona of the individual, like what will trigger them, what will make them tip in and understand, what will motivate them. So I want to talk a little bit about the challenge for designing for all. Right. Is it strategies or just your opinions around what do you think needs to happen to move away from this design for all mentality?
Sure. I mean, I think there can be some standardization in regards to how often a patient should be coming in to get an HbA1c check with their provider. What are the medications that are standard in use, and following clinical algorithms to a certain degree. I like the multidisciplinary approach, though, because that's when you can start to customize towards a patient's specific needs. If you have a patient who is also meeting with a coach, a nutritionist, and also, a nurse who's kind of piecing together the story, on top of that, following up with their provider, you're learning so much about that patient, and you're building a lot of trust between the patient and their care team. And I think that's when the personalization can become a little bit nuanced and multifaceted, in the sense that if the patient is really focused on, if they don't even understand basic nutrition, then how are you supposed to tell them, just eat better? Because that could mean a lot to a lot of different people. And so I think that that's where you can then say, okay, this seems like an area where we can focus more on, and here are the resources, and start to have building blocks, essentially. And then it's just patient empowerment, which is wonderful as a provider to see, and wonderful for the patient.
Yeah. It all makes sense. I like the multidisciplinary approach, and you talked about some of the components of that, like personal health coaching, a nutritionist, it could be a nurse. In terms of, feels to me technology has so many places to be here, right? One is the tech you want into, maybe it's tech, maybe it's not, for an individual and a patient. But then you need the tech to effectively help the multidisciplinary team communicate with one another, help you be nuanced in your approach. So how's that working out? How's the communication, firstly, as a multidisciplinary team working? And is tech an enabler in that?
Tech now is enabling that. I remember when, as a hospitalist, we would have a lot of digital health applications come through, but it wasn't necessarily geared to the provider. It was always geared to the patient. And that's wonderful for the patient. But if the provider is not using the platform, it's very hard for you to build that relationship with the patient because you don't understand it in the same way. I think now a lot of technology is being designed for the patient and the provider to help with the experience. And that is what we're seeing. And there are great companies doing fantastic things on a platform that allows providers to have access across the board, and then also to have for patients to see that and respond in real time. And that's really important. I can't emphasize enough how important that is, because there's been so many times where a patient will come in and they have their app, especially, when I was in residency, they'd have something, and I wouldn't even know what to do with it because you just are. And then that's a little disappointing when you're coming to your provider to be the know all for medicine, which we get stuck with.
No, of course. One of the best product studies I conducted was where the company truly understood that whilst they need to ethnographically understand the patient to build a solution for the patient, they were equally obsessive with the workflow. So they were observing clinician workflow alongside the patient workflow. And that really speaks to what you just said. And I think it's such an important kind of aspect of designing well.
Right, absolutely. And I love that you brought that up. I mean, definitely incorporating it to a workflow, not adding to the burden of the work, is extremely important. And it's really about that frictionless addition that's actually supportive and not additive. So it really doesn't then cause the provider to have to go do one more thing. It's an extra step that then takes them away from spending time with their patient and really working on a treatment plan.
Yeah. You talked about meeting patients where they are.
Mm-hmm.
And couldn't be a bigger advocate of it. Like, honestly, like, that's what life should look like. We are in a culture of on demand. We know that we have a lot of choice and personalization. And I can tell you now, with all the studies we do with Gen Z and the upcoming alphas, which are the youngsters, they are not going to tolerate some of the archaic practices that still exist. Talk to me a little bit about communication channels. So what have you seen to be effective to kind of engage with patients and really deliver on the patient empowerment side of things?
Yeah, it's a good question. I think, well, having flexibility is going to be necessary to meet patients where they're at. It's not going to be a one-stop shop. And now with all the personalization in healthcare, it's almost like patients are expecting that as well. And so, meeting them in terms of their expectations, but then modes of communication is so important, and variety. Surveys can be effective in terms of, just kind of having the patient at least understand a little bit about where we're going in their journey, and for us to understand where they're at. But then it could be text messaging, it could be, emails, some people still like old school mail-in, type of communication, but it's what information is being sent out in what modality, I think, is the confusing but really important aspect of it. Are you sending education via text? Or are you sending education via email? Or is that going over a secure message in your platform? What's the cadence and the frequency that they're responding? Because I think that gives you an indication of what their mode of communication is for them, or their preferred ease in communicating. And some people still pick up the phone, and other people are like, please don't call me. And so it is a really important, and it does play a huge role. But I think we're starting to understand through patient preferences how do they like to be? And it can be as simple as, how do you like to be contacted?
Mm. It can make such a difference to the customer experience, to the relationship building. There's so many portals that sometimes get thrown out to patients that, just have no user experience whatsoever. They're just difficult and clunky. And then it's just like, well, what are you trying to achieve?
Right. And it's a challenge too, because there's so much misinformation coming out in healthcare about one's health all the time. And so you're competing with this misinformation being sent on all areas in regards to communication. So yeah, it can be a little bit jumbled for the patient.
Mm. Let's dive into a therapy area. Let's talk about diabetes, which is, it's a huge prevalence of an issue. It's a chronic condition. What programs have you worked on and implemented within the diabetes space?
Yeah, so we have launched our diabetes prevention program, which is a CDC recognized program that we're going through the certification process for, which has been really successful, and it's around group therapy for patients with prediabetes, and it's been so much fun to watch these patients engage amongst themselves and also learn about nutrition and just really the building blocks in regards to this disease state. We also launched Impact, which is a multidisciplinary approach to diabetes for type 2 diabetics, and giving them a coach, giving them a nurse check-in, and just navigating them through the system for their first 90 days with a diagnosis of diabetes, or for those complex patients who have been kind of lost to follow-up, really giving them the resources and support to get their health back on track. And we use education for that. In some cases, we'll use continuous glucose monitoring to help patients really understand what their behaviors are result in regards to their glucose, how medications can actually help or not help their diabetes. And that's been actually really fascinating to see, because it's that behavioral change that's individual for the patient. They're like, wow, I had no idea that when I eat rice over steel cut oats, my glucose will spike. But that's something that they've been doing and maybe have taught, or culturally what they have learned for a long time. And going back to the cultural part, I mean, I think it's actually really cool, because they're able to then modify what their cultural diet is, but still stay within that realm. So if you're vegetarian, we're not telling everybody, well, now don't be. It's just more, well, then what can you do to kind of find that perfect balance that's going to control your blood glucose without you feeling like you're having to overhaul your entire, food system.
Yeah, and it truly is transformative. I remember, so you talk about remote patient monitoring that you mentioned. It became part of, so we're in the UK and it's a national health service. So we had, it got funded by NHS to say, okay, you don't need to pay out of pocket. We're a national health service, and we will deliver now remote patient monitoring tools to patients. I remember my aunt, so Indian heritage, diabetic. First time we put the remote monitoring device on her, and to watch her kind of understand every time after she ate, and there was some serious butter going into those dishes every time she ate, and then just spark and realize.
Yep.
I mean, that truly is something else. I mean, when we talk about transformative tech, I mean, you and I have talked about remote patient monitoring so much. Talk to me a little bit more about it. I mean, how can we take that experience and apply it elsewhere?
Yeah, I mean, I think that it's exactly that. It also reinforces the education that they're receiving. And so nothing reinforces it more than you actually wearing it, eating something,
Yeah.
and then seeing a spike, and then all of a sudden understanding, oh, this is how I actually tie it back to the education that I have received. So that in itself can be extremely rewarding. It also then starts to help the provider as well, when you're starting to explain to patients how they should manage their disease, that the patient's starting to do that on their own. And so it can be extremely eye-opening, but then transformative. And I think the technology is one of those things where it's not going to be a one-stop shop in solving chronic conditions. I mean, human-led engagement is so important when it comes to the usefulness and the adaptability and the efficacy of technology. And we've seen that, some patients will take a break from their monitors. They'll take a break from their digital health application. And that doesn't mean that you take a break from your patients either. You still need that conduit to be there between the healthcare provider and the patient and their health goals. And so if there's not that warm person at the other end of the technology, when we see these drop-off rates, that can be quite high in some cases. And so that leaves me hopeful that you can, as part of this multidisciplinary approach, this team-based care, part of that team is the digital health device that you're actually, utilizing in the same way. And it's really you have a toolkit, a toolbox, and it's one of the components in there.
I think you make such a good point here, because one of the big contentious issues that we've seen over the years with digital and connected health is it lacks sustained use. So we have people pivoting in, trialing, and with Fitbit, you've always used Fitbit because it's just easy and accessible. But, Fitbit, you learned what 10,000 steps looked like. You learned how long it took you to get there. You started to understand what that success is. And then it dropped. And then you had all these drawers full of the wonderful original Fitbit. Then they evolved into smartwatch, and they're doing great stuff. But let's talk a little bit about sustained use. What are the ingredients of that? I mean, you talk already about multidisciplinary, which I think is the heart of it. But, any more thoughts around sustaining use of tech?
I mean, I think, tech is, that's why you get an iPhone every year, right? I mean, I think that you don't necessarily need it, but you get it. What are those key applications that are important to the patient and important to the provider, and not overwhelming with too many gadgets and too much information. I mean, and there is something as having too much information that can then cause you to kind of just shut down. And so the sustainability is a great question, and I don't have a great answer for it, unfortunately. I think we're still trying to work through that. But I think it at the same time, you can switch through a lot of these as you want to. You want to know a little bit more about your sleep. Okay, then I'm going to wear this device. If I am interested in learning more about my heart rate, then I'll wear my iWatch. Or when I'm going for a run, I want to see what that actually does to my blood glucose. And I think that's where you can start to move into the preventative space as well. And performance, productivity, efficiency, and even, exercise, from a fitness standpoint. You have a kind of an armoire of devices, so to speak, that you can kind of borrow in and out of. But I don't think we need to clutter the space. I think that I think that's really important, and validating some of these, a lot of products have not been validated, is going to be the next key step in really helping providers, patients, healthcare systems understand what is the best use case and how do we use these to appropriately affect patient care.
Yeah, applicability, right? It's like I can do all these things, but how are they, enriching me and informing me? Right. And sometimes you're right, sometimes it serves its purpose, and that's when the trial and error space exists. But sometimes we have we end up with ecosystems like platform providers that actually understand they need to make acquisitions and integrate other services to continue to be relevant. So we're coming close to the close up. We're about 5 minutes out. So it goes quick. Yes, it does. Much to do with the speaker. So yeah, thank you. You're, for me, at the front of this transformation that's taking place. To be honest with you, it's really accelerated this last year, and we know why. So what are some of the things that you've learned in your role, just from your side, about how to really move the needle, and what are some of the things if other people are looking towards you thinking that's what we need and we need to bring a role like that in? What are some of the learnings that you could share?
Yeah, I think that this year, so many things from this year, but patients like to be seen by their providers. Actually, even when we went and sheltered in place and we switched to this, remote visits and video visits, the minute they could, they were back in the office wanting to, and they treated it like it was, Christmas Day or something like that. They get dressed up. They really want to see and have that interaction. And I think that that goes back to, this human-led engagement is going to be really important. But what was fascinating and really helpful is when the pandemic started and we had a lot of patients who did have chronic disease, we were able to reach them even though they weren't able to come in, and actually still through this multidisciplinary team-based approach affect outcomes and continue to keep their health at the forefront of their priority list and our priority. And I think moving forward, technology is not going anywhere. And I think a lot of this is going to be now validating what technologies did actually serve and what technologies were actually really helpful. And where do we take that next? And I think that will be in the prevention space as well. And how do we complement a patient's visit using digital health devices, remote patient monitoring? How can that support their short-term and long-term goals? And yeah, I think that if from what we've seen as well, it's supporting the provider in that journey is going to be really important to enable accessibility and adoption globally.
Absolutely. I mean, we have a large study we conduct each year, and I'll give it a little plug now. It's launching on Tuesday. It's called Digital Doctor, and it's 14 countries, and it talks to doctors around the world. And what we've seen is this shock to the system. Suddenly, we all have to be in, like you say, tech was an enabler. It was a lifesaver, being able to go on and have a conversation. But there still seems to be some trepidation around, well, what will remain? And some of the challenges we're seeing as well in the report are the ability to deliver holistic care. So it feels to me like there will be moments which virtual care really delivers on, and there may be others which are not. So kind of from your crystal ball, where are you seeing it going? Where will this kind of move to post?
I think it's complementary. I mean, I think you said it. I think it'll be holistic and complementary. In certain situations, you might not need them to come into the office, and you can do things with the aid of device and remote patient monitoring, which is fantastic. If a patient gets admitted into the hospital, there might be more communication between the provider and their hospital stay because they have devices that feed back that information. That can be huge from a readmission standpoint, but then also from a patient care follow-up standpoint. And so I think it will be lovely synergy and very complementary in regards to use cases. I think it will allow for extreme flexibility as well, both from the provider standpoint and from a patient standpoint. And I think that will lend to, if we can get it right, and if we're going into a direction where we're using it responsibly, it can get to a point where you're really starting to build that patient-provider relationship, because should that provider go, move to a different state, they can still have that continuity, and it's not left on the onus of just that provider taking care of that one patient's condition, because we have much more data and we have a story for that patient that someone else can then pick up and run with instead of starting over again.
And I think the equipment piece is the other thing, right? So to do it well and to have this synergist of kind of being able to go in and out, one of the big challenges this year has been like, you just don't have the equipment. Right. Like the smartphone can do so much, but it's still, unless you have invested yourself. So I think part of the field and the industry's call to action here is thinking about solutions in the home, right, which can really contribute to elevating health-related conversations.
Right, absolutely. And we see this now in aging adult services and in the Medicare population. How can we facilitate patients to live independently for as long as possible in their homes, and provide technology that's friendly and easy to adapt, so that they have their dignity and they can stay in a place where that fosters their health.
on that note, we have hit the 30-minute mark, and we thank you so much. Thank you to everyone that's attended and listened. I have no doubt it's been interesting and engaging because, you know, Hemalee is fantastically interesting and engaging. So, but Hemalee, thank you so much. Thank you so much for your time. For those who have dialed in, please do follow Reach Live. It's an event that we do, well, it's an online event that we do every month, and do make sure you subscribe and follow to Reach Thought Leadership. With that, I say thank you. Have a wonderful Friday wherever you are, and be safe.
Thank you, everyone.
Thank you. Thanks so much, Hemalee.
Take care.